Hi, everyone. Dr. Klinghardt is just finishing up lunch and then he's going to get started. Um, Thanks for all the messages so far. Does everyone hear me okay? Can you let me know that the sound is good? We were just muted. Okay, great. Thank you. Um, Great, perfect. So Dr. Klinghardt put together a really, unique presentation for you all today, and we're trying to give people more and more information about what we're seeing in practice. And the dental thing comes up for almost all of our patients, and so he's going to give just his perspective, his overview. He's been practicing now for maybe over 40 years now, 42 years. So he has a lot of experience in this work. And I know this is a tough topic. And so we're just going to give you our perspective and overview. And I really appreciate a lot of you reached out to me with a lot of questions that you have. And I think, this is great. I put a slide together at the end, and he's going to go through as many questions as possible. I do see that some people are already posting in the question and answer part of the webinar. And please, feel free to do that, but we might not get to all of those. We're going to try to limit this to an hour. Dr. Klinghardt could talk all day, but I feel like he'll get through a lot of it in an hour. This will be recorded, and so if you miss any of this, or if you have to leave early, we're going to be sending the recording via email, so don't worry about that. And then I know a lot of you are in different time zones, so I really appreciate you joining us. So give us a few more moments, and then we will get started. Dr. Klinghardt's in the middle of his patient day, so he is just, going to step out and give you all a lecture, which he loves to do. And we're hoping to give you more and more education. Since we did the Heavy Metal Summit, we feel there's this huge opportunity to be able to share more of what we're seeing at Sophia and help more people through more educational venues. So please feel free to share with us more and more about what you want to hear from us. We're in the process of creating a mini series on brain detoxification and just giving you some overview and practical protocols that you can do at home. So look out for that. We'll share more information probably in the next week about that. But yeah, I appreciate everybody jumping on. And then um, let's see. So the sound looks good. So if you're having issues with sound on your end, I would say just make sure that your volume's turned up, your speakers are good, that you're not muted, that you don't have any headphones on. But I think we're all good on this end. And then let's see here. Let me just see. I have a couple more questions about when the webinar will end. When Dr. Klinghardt comes on, he'll probably talk for about an hour. So if you guys have an hour, that will be the length of time. Again, it will be recorded, so we will send you the recording if you can't stay for everything. Okay, and then let me just see if I can answer any questions. You all have a lot of great questions, and I know that you guys are so educated and probably have been through a lot yourselves. And, I know this is an important part of our work. Okay, so, okay, let me just see. All right. Well, again, Dr. Klinghardt, he is just finishing up lunch, literally. So he's probably going to come in a few moments. He's always a little late, so we'll not let that stop us. I'm going to make sure this is recording. So that is. So I'm happy to, start answering some questions, which what I know. And then we can get started. Oh, here he is. He's on time, 1:30. Look at that. He's German. Okay, so hang tight. I'm going to just turn off mute and audio while we get him set up, and then we'll be right back on. So just hang tight, and we'll be right with you all.
So I'm on. Hi, everybody. I don't know. I hope you can see the screen that we have here. I can only see part of it, but maybe you can help taking the thing out.
You don't want that in?
No, I just want to be able to see my text.
Oh yeah, so you're just here. You just took here.
Okay.
Perfect. Is that good?
All right, gang. So let's go. So I'm going to give you a brief introduction to biological dentistry, and hopefully you learned something, and also that you know how to apply that, what you learned to yourself and to others around you, and if you're a practitioner, to patients. So basically, I do feel in primary school, children should learn everything about the teeth and the bite. And it's appalling to me, sometimes even today, to see that the bite the occlusion is horribly off in some of the children, and it's not known that there's a huge connection between how the bite is and the brain health, and brain health is worldwide going down. So here, I take you for a little ride, on, okay, it's of course not working. Destiny? It's not responding to, like I was just introduced, to pushing down. So will it work now? Okay. Good. So first of all, a little definition, what is biological dentistry? For you, I think many of you know, but the FDA has ruled that amalgam fillings, which contain half of the weight of an amalgam filling is mercury, are a class 2 device. A class 2 device is a cane, is a helmet, is a jacket that you wear. So for the FDA, the filling materials and the restoration materials in the mouth are considered to be outside the body. However, of course, they're in contact with the dentin tubules and with the immune system through the tooth, but they're also in contact with your system through the saliva. So it's an absolutely ridiculous, outdated ruling, and also to know that the American Dental Association holds the patent on amalgam fillings. That means every time a filling is placed, they benefit from it. And of course, that's a conflict of interest that couldn't be any stronger. So what is biological dentistry? The amazing discovery that the teeth are actually part of the human body and connected to it. What you put in a tooth and in the mouth does matter. That's the amazing discovery. So let me take you through it. So here's some of the old amalgam fillings. So mercury in the mouth does not stay in the mouth. So a silver filling typically evaporates half of its weight of mercury within the first 7 years, and 80% of that stays permanently in the body. So it just gets displaced from the filling into the brain. Here's the beautiful study around 1990 from the University of Calgary. They placed a few amalgam fillings, radio-labeled the mercury in the jaw of the sheep, removed it properly with suction, rubber dam, and all that a few days later, and then scanned the sheep a few weeks later to see if any of the mercury has left the fillings that were in there for a few days. And this is what you see, that the whole jawbone is penetrated with mercury particles. So is the lymphatic system of the gut, and the side-lying letter B, that's the kidneys, and in the back, that black spot is the spleen. And those of you who have trouble as you're advancing in age, you start losing teeth, or teeth go bad in the mouth, or your jawbone gets infections, gets cavitations, look at the black jaw of the sheep. Any one of you who's ever had amalgam fillings for more than 4 or 5 days will look dramatically worse than that. That means your whole jawbone is infiltrated with mercury particles that inhibit healthy bone growth, healthy bone flow, the lymph flow, blood flow, oxygen flow through the bone. Everything is compromised and things go bad. Okay, myelin sheets bind heavy metals, so it's important for the MS community, but also our Lyme community, that a lot of the damage that we see is in the myelination of the nerves. That's the insulation around the nerves. And unfortunately, myelin binds heavy metals and then becomes completely dysfunctional. Here's a little bit from Vera Stiscol. Basically, what you see on the left side is a cell that has sticking out a sulfhydryl group. That's one of the markers that every cell has on the outside. And then you see that there's a so-called sulfhydryl affinitive metals, mercury, silver, gold, nickel, titanium, and many others, lead, that bind to these receptors and are permanently attached to the cell. And then what happens is that cell no longer is recognized by the immune system as the body's own cell and starts attacking it. That is the basic mechanism of most, if not all, autoimmune diseases. And so therefore, of course, the primary goal in autoimmune disease is to remove the metals from the body with, fortunately, we have agents now that are actually capable of doing that. We were pretty good until recently, but now we're very good. Okay, I don't know if you can read the text on top. And my thing, I can't read it, but basically macrophages, these are cells of your immune system, cannot handle metal ions. What they do, they take them up, but then it actually destroys them. Or they take the metals up, they mop them up, and then bring them to the brain, cross the blood-brain barrier, and drop them off there. So the macrophages are dangerous transporters of metal ions. Sorry, show me. Are we having some computer problems here? Yeah, this is. Okay. So the question has always been, well, how should we detox metals in the body? And so here's a beautiful article from the British Journal of Medicine and Medical Research that shows clearly and very, very clearly, if you compare DMPS, alpha-lipoic acid, DMSA, D-penicillamine, everything, EDTA, DMPS stands out as the most effective detox agent. And I'll read the conclusion. Intravenous application of DMPS is most useful for the diagnosis of multiple metal overexposure. It is also the treatment of choice for various metals that are mentioned here, and has the strongest copper binding ability of the chelators tested. That means we can, in our cancer patients, we use DMPS to lower copper levels, which is very, very important. We monitor the ceruloplasmin. So here's one of the more dramatic cases that may highlight a few things for you. So on top, you see this is a dentist I treated, a young dentist. He was 35 years old with severe chronic fatigue and fibromyalgia. I diagnosed him as mercury toxic. So in April of 1993, I gave him a shot of DMPS, and he released a little bit of mercury, 27 micrograms. Okay, it's a good number. Then I gave him, every 2 weeks, I gave him a shot, but we didn't test the metals every time. So 2 months later, it was up to 99. And then 8 months later, it was down to 2. And we thought we were finished with metal detox. This is the learning curve now that I'm taking you through. However, he was still testing for mercury with the neural therapy. And so what I did a few months later, I used the DMPS together with Procaine and injected, like some of you have been through, the ganglia, the skin overlying the liver and the kidneys with DMPS. And then we got these numbers, 1500, 14.4. The person at the time that ran the lab called me and asked me if the patient is still alive. the patient was doing fantastic after that. Yeah, and so what we learned there is the MPS giving it IV is nice, and that's what everybody does, but it's not what we do here. You know, there is a much, much better way of doing that. And then I don't know, I can't scroll down on this one, so I'm inhibited here with okay, Destiny is trying to help me to well, just leave it. Let's leave it. No, it's just not ideal. Yeah. Yeah, leave it alone. Come, it's taking too much time. So the case below is even more dramatic. There was a woman, a famous musician I treated, and she did not produce any mercury, even though she was highly, highly toxic. And then what happened then, I did a psychological treatment with her that revealed that she was sexually abused, actually by a dentist when she was a teenager. And we brought some resolution to this. And then I was smart enough to immediately give her a DMPS shot IV, and it revealed until then it was the highest level of mercury ever coming out of a living person. And it was curative for the patient. So it took then another 4 or 5 months of weekly shots to get the levels all the way down and get her completely stable. Here's a little bit of a picture of the nerves in the face and mouth. And some of you who are our patients know that we tend to inject those nerves because it's the nerves that transport the mercury and the infectious agents from the teeth to your brain backwards. You know, we can inject the different ganglia, the different nerve cells that you see here depicted with DMPS, with other chelating agents, or with artesunate, or just with procaine, in order to flush out toxic material that's building up there. That's been one of our biggest discoveries in our medicine. Here's one of the injections that's not so important. Now, in terms of detox, some of you know that I've explored pretty much every corner of the planet to look for biological, natural ways of detoxing people. What you see here is the result of a study I did together with Margarita Gris-Bresson. She's a very, very gifted neurologist working in England. And basically, people were treated with just taking cilantro and then having a foot bath, an ionic foot bath, which some of you know we highly recommend. And what you see basically is the urinary excretion of virtually every toxic metal increases above baseline. And so there is another way of detoxing patients, and that's having parasites. Yeah, so there is a large number of articles that shows that parasites have the ability to extract from our tissues toxic metals and concentrates them in themselves. That has a plus and has a minus. The plus is the patient is less toxic for metals and survives. The minus is that a parasite that is fortified with mercury and lead in their coat is no longer, the body is no longer able to kill the parasite. So the parasite lives. So it's a deal. It's an uneasy alliance, as I call it. Okay, now this was chapter number 1, a little bit the toxins. Chapter number 2, the occlusion. The bite is key to a healthy and long life. Well, not everybody is gifted in that way. Here is the key article from 1989 from the Kyoto Medical University in Japan. What they did is absolutely amazing work. They took beagle dogs, and on one side of their jaw, they ground down the teeth tiny, tiny bit, 0.5 millimeter, a tiny, almost imperceptible amount. All the dogs developed severe autonomic dysfunction, autonomic failure, movement disorders such as Parkinson's disease or paralysis of limbs, absolutely astounding catastrophic events. And then they followed that with another study where they actually did the same thing, the same problems, and then built up the bite again to where it was before, and all the symptoms disappeared. So What that means for many of you who are listening in on this, none of you have a perfect bite. Unfortunately, the dentists I used to work with that were absolutely astounding with the bite, such as my friend Dino Paulos, have all died or retired. And I do not know the young crop of dentists. It takes a dentist 40 years to get good at this. And so I am teaching in England workshops to dentists on the Klinghardt Institute of how to properly test the teeth and the jaw and come to the right conclusion with that. A little bit on the psychology. I think some of you have not heard me talk about that. So here you see the bite, the upper jaw of a 16-year-old girl. She was sexually abused in earlier years and had a desperate need for protection. Yeah, so it's this tooth number 5 that's standing on the inside that represents her soul, her being, the core of her being, and is protected by the other teeth. You can virtually see how the jaw is following the psychology of this girl. What we perceive as harmony in the front of the teeth is always the front teeth. And the right front teeth represents the father archetype, and the left one, the mother archetype. The diastema, when the teeth are separate, it often represents a separation between mom and dad. In this case, this patient was 6 years old when the parents separated. And this is, mom and dad fought for years, dad disappears, girl raised by foster parents, and you see sort of the separation of the front teeth as a response to that. Okay, and then we have this situation. This is some of my German text, but you see the central incisor on the right side overlapping or pushing back the central incisor on the left side. And the right side, the right tooth represents dad, the left one mom. And in this situation, dad was an absolute tyrant at home and putting mom into the corner of cooking and making the beds. And you can virtually see that expressed in the child's teeth. Okay, there's many different ways of coming to a better dental alignment. The Bionator is one of the tools that I highly, highly favor, but there is in the US very, very few dentists who know this instrument or know how to use it. Here is a really, really important article that shows when you get older and you lose teeth, or the height of the teeth diminishes, the teeth cannot get pounded into the jawbone, and you lose relative height of the teeth. That is associated with cognitive impairment. That means your memory goes down, your higher thinking goes down, everything goes down. And then the beautiful thing is the last sentence here: whether chewing ability was sustained with natural teeth or dentures also had no bearing on the effect. So basically what they found is that when you bring the height of the teeth back up and you fill in the missing teeth, your memory, your brain comes back. And this article was the real reason, this is 2012, why I became so strong. No, we cannot leave holes in the jawbone. If the teeth aren't high enough, they need to be built up with either splints or crowns. And if you have missing teeth, they need to be replaced with zirconium oxide implants. We get into that a little bit later. So the cavitation issue, there is these ugly holes in the jawbone that are filled with, often with the oily mass, and filled, we know that now from dental DNA testing, filled with a gazillion different pathogens. The main one that we find in there that's really driving the whole event is Bartonella. There's different ways of testing for the cavitations. These holes have a huge effect on brain health, but can also cause cancer, can also cause neurological disease. Many of you who listen to this have been through the surgeries, which we still prefer to have done in Switzerland or Germany. The dentists that were good here or got seriously attacked by the dental boards, and I don't want to place the burden on the people here, so we send people over there where there is much less questions asked, and the quality of the work is fantastic. We use swissbiohealth.com as our go-to place. Here's the procedure me and my friend Ara in Vancouver developed. If there is a hole in the jawbone or an unhealthy tooth that's struggling, we can use this equipment. It's called X-Tip. It's basically a small drill bit that you stick into the jawbone, and then you can inject ozone into the jawbone. Phil Mollica has an IRB on this and does extensive work with that. We no longer do that in the office, but there's dentists around here that are very good at doing this. Okay, and then what's in these NICO lesions, as we call them? NICO stands for neuralgia-inducing cavitational osteopathosis, I think, or osteonecrosis. What you see down here is a breakdown of inflammatory peptides, inflammatory cytokines that are created in these cavitations. And what you see on the right side is this accumulation of a huge, dense population of inflammatory cytokines. They're carcinogens, they're inflammatory, they're pain-causing. And these cytokines leave every day from these cavitations and circulate in your system. Some of them migrate up the trigeminal nerve straight into the brain. Others are picked up by the lymphatics, others picked up by the bloodstream, and find then their target organs. And so RANTES is the proper name, regulated upon T cell expressed and secreted. Doesn't really matter the name, but there is actually a blood test for RANTES that you can run that shows how severe the poisoning is from the jawbone. Okay, so here's the article that went with this RANTES study. Basically shows that it's an absolute disaster, these holes in the jawbone. And as you know, there's no patient that we have where we don't look at that. And it's almost always a contribution to the patient's symptoms, to their illness. And so we're trying to address it as early and as quickly as we can. I do have to say here that the quality of surgical work is a world of a difference between different dentists. And I don't want to talk bad about anybody, but in Switzerland, it's very, very rare that we have a patient who ever has any pain sensation afterwards, never have any swelling afterwards, any bruising afterwards. So there is a quality and there is a knowledge and know-how that has faster grown in Europe than here, because in Europe we don't have a American Dental Association, which has obstructed the forward movement in dentistry as much as they could. So here's a little bit about what the RANTES from the NICO lesions, from the holes in the jawbone is doing. It's damaging the endothelium, it's damaging the joints, it's damaging the mast cells. Many of you have this mast cell activation syndrome, and please, this is the most likely cause from it. Then the central nervous system gets damaged, and ultimately they're carcinogens. So, good. The allergies, the MS, the Parkinson's, the brain cancers, the breast cancer. Good. And here's a couple of things that I enjoy showing you. So, the first time Bartonella was found in a human tooth. And as I said before, in the cavitations, usually we find Bartonella. That's why the cavitation issue has become worldwide, like an epidemic in the last few years, because Bartonella has spread at incredible speed. Now, this is admittedly Bartonella quintana. That's the one that killed Napoleon's troops. But they also found it here in a mummy. So Bartonella has always invaded the teeth, and here's an article from the Journal of the famous American Dental Association that is suggesting dental physicians, dentists, should become literate on Bartonella because it is such a frequent infection in the jaw and in the teeth. Some of you know we treat Bartonella with biological agents. We use BioPure's propolis tincture and calendula and a few other things, the lime cocktail, and this works wonderful for that. Now, titanium in the jaw acts as antenna for microwave radiation. So I'm not going to go into that, but we are not friends of titanium, any metal in the jaw, because of the incredible increase in microwave radiation. We do not need to have an antenna for microwave in the jaw that amplifies the radiation, which on its own is carcinogenic and neurotoxic and causes all sorts of damage. And then when you put metal in the mouth, it concentrates the radiation in your jaw, and your brain is just going to go down. Okay, well, here is our treatment room. Some of you have been here. So what did I learn? Just a few things. People today are toxic. The teeth are no longer the biggest only source of toxicity. It's insecticides, food preservatives, flame retardants, others. But ahead of all them is aluminum toxicity, a byproduct of the global climate control effort. Aluminum is the main source of inflammation in our vascular and nervous system. The effect of all toxins is cumulative and synergistic. Now, some of you know Klinghardt Institute is my international website, and there we teach extensive courses, mostly in England, of how to get the aluminum out of the system, how to get the pesticides out of the system. That's something you're all invited to do. And then the second point, the more toxic the terrain, the more pathogens and parasites in the system. There's a lot of evidence of that in the literature. And then the third point, cavitations are no longer tolerated by us humans in the greater context of systemic toxicity. Yeah. So what I'm basically saying here is all the toxins in our system sum up. That there is a bag, a can that fills up more and more. And it is possible that people always had cavitations and the body tolerated them. But right now they're adding such a heavy weight to the overall toxic burden that that's one place that we can easily eliminate the source, and we should. Something every dentist knows, gum disease is a symptom of systemic illness and has to be addressed that way. So to treat gum disease, like with brushing your teeth or mouthwashes, is a joke. You need good probiotics, you need to treat parasites, you need to treat liver problems, you need to detox the patient. Well, then there is the allergy to dental restoration materials. So we have, our ART testing has now been published in PubMed as a very, very valid and reliable method of testing for allergens. And so it really shines when we test dental restoration materials. And so the important thing is that what people can be lifelong allergic to a whole set of crowns and fillings that are put in the mouth. And these allergies will cause chronic fatigue, the mast cell problems, the gut problems, inflammation everywhere in the body. And it's usually not the crown or the filling material, it's the layer below it. It's the bonding material or the smear layer that's put by the dentist between your natural tooth and what's built up on top of it. And so a big word in our world is immune tolerance. So the more tolerant your immune system is, the more you're going to tolerate dental restoration materials. But once you're allergic to it, we teach at Klinghardt Institute, I teach how to desensitize the patient to their own fillings using different color lasers in different ways. Okay, point number 6, the loss of vertical tooth height. With age decreases acetylcholine in the brain, the memory goes. If the bite goes with tooth loss, so does the brain. We have to restore the bite, respecting the vertical height of the restoration. So that's the easiest way to get somebody out of the track of Alzheimer's disease, back off the track, by building the bite up to the ideal height. And unfortunately, I do have to say that you kind of need my ART testing to know where that is, because there's only confusing rules in the dental world that are not respecting the physical body and the relationship to the body. And so with ART, we have a way of testing for that. Okay, titanium in the jaw is structurally great and perfect, but 25% of people become allergic to it. And then the environment of where the titanium is gets impregnated with titanium particles. Since nanoparticles of titanium are now in the air and in the food, all of us pretty much are sensitized now to this number. 25% that was 20 years ago. I would dare to say it's now up to 75%. And so titanium is a no-no. Zirconium oxide is a non-conductive ceramic material. It's also known as a healing stone in several shamanic traditions. It occurs naturally. And the new generation of German implants is strong. Implants, well, with fewer problems, well tolerated. It's light conducted. And the beautiful thing about that is you can conduct laser light through the implant to the adjacent jawbone, assuring better osseous integration and healthy signaling to the meridians that the tooth is on. Okay, so Christine asked me to preempt a few questions that you may have. So let me just sum up what we said so far. So there is a number of issues in the jaw that you should be aware of. One, that most, amalgam fillings are toxic. They should be a thing of the past. But the other filling materials that are placed in there, you can still be allergic to it, and they still also are toxic. You know, many of them contain bisphenol A. So we had a number of people that had their amalgams taken out and then had bisphenol A containing plastics put in, and then got breast cancer or prostate cancer. Very, very clearly linked to that, even though that's denied, of course, in the literature. That's why we prefer to send people to Swiss Biohealth, because they have a completely bisphenol A-free filling material. So that's the material issue. And then there is the height of the bite, which is unfortunately where most dentists are lost, because they don't have a test that you can do x-rays of the skull and try to find the right plane of the bite. And some dentists can make that work to a degree, but it never really works out in relationship to the body. So for this, I invite you to my dental courses, both at Swiss Biohealth and Klinghardt Institute in England, where we do the hands-on work with that. Okay, controversy of implants, to get an implant or not. So I think I answered that question. Absolutely, yes, you should try everything you can to restore your bite if you want to keep your brain. Thought on dental x-rays. So dental x-rays have been shown, 3 or 4 panorama x-rays are increasing the risk of thyroid cancer and several other cancers. The new 3D x-rays use less radiation, but unfortunately, because of that, they cannot penetrate hyper-dense bone, and so they create an image that's not reflecting the truth. So you overlook, with the 3D x-rays, very, very often overlooks big cavitations that cannot be seen there. They can only be seen on a dental x-ray. We're all for the panorama x-ray, cancer or not, because we are, I hope my assistants are doing that too, pre-medicating our patients with both propolis and rosemary tincture. That has been shown to be totally prophylactic. We have a product in Key Science, KI Science. It's called Raywave, and that has both in the perfect proportions in it. And it's like you start taking a dropper full of that a few times a day before the dental x-ray, during and afterwards, and there is absolutely no concern with it. So safe and inexpensive mercury detox past amalgam removal. So that's of course a big issue. A little story to this one. So I had a patient in my early days in Sanofi. We're talking mid-80s, so we decided he had his amalgams removed. And so, as it was done in those days, the dentist did 1 quadrant at a time, and the patient submitted to my idea to run an IV vitamin C while he was actually going through the amalgam removal. That was at the time highly recommended by Hal Huggins and others, and it was beautiful. So on the 4th quadrant, the patient wanted to save money and didn't do the IV. He developed a herpes zoster outbreak in the face that became so severe that he committed suicide a year later. Why am I saying that? Well, there is a right way of doing things and there is a poor way of doing it. So we pre-medicate people with high doses of chlorella or another binder. Zeobind is the most common one that we use. A little less often used, but very good also, is Eclonia cava. So we do that as a preparation for the work. Then when the amalgam is removed, of course, it should be done by a dentist who is IAOMT approved. It's the International Academy of Oral Medicine and Toxicology. He does have to use the Swedish suction bit that's put right over the tooth. The rubber dam itself doesn't protect from mercury vapor, but it protects you from swallowing whole amalgam particles. The dentist should give you, during the procedure, nasal air, not nasal oxygen. That is so misunderstood. Most dentists give you nasal oxygen. That should be malpractice here. Oxygen up the nose opens the blood-brain barrier, and that's the one thing you do not want, an open blood-brain barrier when you have the amalgams removed. But you want to have an air supply that's not full of amalgam vapor, that is created when the thing is drilled out. So these are just a few things. And so what do we do after the amalgam removal? So Max Downderer, my mentor in this business, he had people chew on activated charcoal immediately afterwards, to take ideally the capsules, open it, put some of it in the mouth, slush it around, let it sit there for 10 minutes, wash the mouth out, do it again. Do that a few times over the next few days, in addition to the binders. During the amalgam removal, when it's more than one tooth, it is very, very much desired to give the patient 25 or 37 grams of vitamin C. Now, the safety of that should be established, to make sure they have no mutation that makes them incompatible with it. The worst thing that actually happens after amalgam removal is the bite. That every amalgam removal patient ends up with a bite that's worse off than it was before. And it's an art for the dentist to adjust the bite afterwards. Often he drills away too much, and then they have a deficient height of the bite, and then you get the brain fog for the rest of your life. So, but I think I said enough so you get the feeling of this. Okay, are there safe root canal procedures? Okay, again, a story. This was when my friend Dino was still alive, and I worked very closely with him here in this region of the world. So the leading group at the time in biological dentistry sent me a young woman, about 30 years old, with severe MS, was in a wheelchair, and she just had her 3 or 4 root canals redone with a new method using ozone and using calcium hydroxide, so completely innocent materials. And I tested her, and of course and the dentist who referred her to me, who was the head of the whole organization, said, well, Klinghardt, you don't have to worry about the teeth. Don't just take care of her MS, but don't worry about the teeth. Well, of course, on day 1, the teeth were testing, the biological root canal filled teeth were testing, but I ignored it, and so I treated her for almost a year. I got her out of the wheelchair, but still walking on crutches, but she wanted to get pregnant. And so there was a moment of honesty. So I sent her to Dino. He took the root canals out. we have a video of that is a tearjerker. You see this woman at first hardly functioning, and then after removal of the biological root canals, you see her running up and down a staircase, a steep staircase, smiling without any limp or anything. And also in the same video, you see her with the newborn baby a few months later, you know. So yeah, are there safe root canal procedures? The answer is no. What if you have titanium implants in other parts of your body, hip replacement? Okay, so the further the titanium is away from the brain, the less problems we see. However, when you have a gold crown and titanium in your hip, it sets up an electric current between the two. It sets up an electric potential that leads to ion migration and very rapid dissolving of the lesser metals that are involved in the implants. Usually, you know, there's usually some other crap in the implants. It's not just pure titanium. So that issue comes up a lot. Now, maybe I want to say that also here. The whole implant business, or putting metal in the body to reconstruct a joint or to fix a spine, was developed by the Society of Osteosynthesis in Switzerland in the 1950s. And an absolute firm part of the teaching is, if you put metal in the body, you have 9 months and then you have to take it out. The US is the only country that keeps, you know, after a fracture, keeps the metals in for life. After whatever, you know, event, when there's metal put in, it stays in for life. And so it is malpractice, it's not right. And so, however, you know, if you do a hip joint replacement or knee replacement, you've got metal parts in there, you have to live with it, but then it becomes absolutely important that no other part of the body has any metals. You're not even allowed to wear gold chains, gold rings, earrings, nose rings, whatever, no other metal in the body. And then usually the hip replacement or knee replacement is tolerated quite well. Are gold crowns safe? Yes, gold crowns are in generally safe, but most gold crowns in the US are not gold crowns at all. The gold, palladium, nickel, and 25 other metals crowns that look golden. The moment there is palladium in there, it's highly, highly allergenic, highly, highly toxic for the system. And so palladium is added to make the gold more firm so it doesn't get chewed down. And so in general, if you have a mouth full of plastic fillings and 1 or 2 gold crowns, I would certainly leave those alone. But if you have wall-to-wall gold crowns, it's not safe. And there should be, there is metallurgic exams, but we do it with ART. We check very reliably if there is palladium in there, if there's nickel in there, and then they need to go. And in the last 6 or 7 years, I have not seen an American gold crown that was safe because of those issues. Okay, can you treat cavities naturally is the question here. Well, you know, we have the discovery that xylitol as a wood alcohol can actually stop tooth decay and sometimes even regenerate the tooth. I know there is a lot of people working on that end now, trying to find also bone pastes and phosphorus-based paste to see if the cavities can recover. There is much better way of dealing with cavities now using plasma light instead of the drill and you can you don't have to drill so deep anymore. You can, the plasma light penetrates 2 to 3 millimeters. So if a cavity is close to the dental pulp, in the old days it was a death sentence of the tooth, because then you had to you know, open the pulp, and then the rules were you have to do a root canal, and then the patient got cancer and died. And so treating cavities naturally, it's limited so far. I do like the xylitol idea. I do like the more gentle approach with cavities, not drilling all the way down. There is the dye that can be used now that shows where there still is tooth decay. And then if you estimate that it's 2 millimeters or less deep, you can just shine a plasma light on there. There is one of our dentist friends here in Seattle has that light from England. It's fantastic. Thoughts on treating gum disease is the last question that I have here. Gum disease is a oxymoron. The gum is the beginning of the intestinal tract, and anything that goes wrong in the gut will express itself as gum disease. And so the treatment of gum disease usually is a whole treatment of the whole gut. And everything that you know from us, treating the parasites, treating SIBO, treating the viral infections that are often a role in it, treating the leaky gut, all become part of the major picture. And then the gum disease is a relatively small part of that usually subsides when the other issues are addressed correctly. That's really all I can say to that. We don't have, in our patient population here, it's amazing how rarely we see gum disease. You know, the Indian population, I may have mentioned that here, the Indian population has devastating bugs in their gums that we checked with the DNA connections, bugs that would kill somebody else, but they have absolutely no gum disease with it. And so what I want to say really is the relationship of certain bugs in the mouth causing gum disease. That relationship doesn't turn out. It is, you have to look at the diet, the food allergies, the parasites, all of that. So let me see what else I have here. So brain detoxification mini series. So this is something coming up. Are the 3 modules that we're putting together for educating you. And here is sort of my last page. So the Sophia Health Institute, some of you, or most of you know it. We are a group of, I think currently 8 practitioners, 2 nurses, and wonderful supportive staff. And we're trying to do the right thing with everybody. As a side of that, Christine also has an office here that is more focused on well-being and beauty, people that are not so sick. So we do recommend that also. And my own personal website is klinghardinstitute.com, and I do put workshops together, mostly in England, that amongst other things, workshops for dentists and physicians to teach them how to diagnose non-invasively with our ART technique, diagnose all these problems, you know, how to diagnose a cavitation, how to find the right bite, how to know whether you're allergic to a filling or not. Basically, ART fills a place here that medicine so far has left a vacuum there. We do not have a reliable good materials test. The test in Colorado Springs has been shown many times to, you know, be split sampled. I don't want to really talk bad about it, but we do not have a reliable test for dental materials incompatibilities. We do not have a reliable system in medicine that can give you the correct bite, the bite that's best for your brain. And we attempt to train not only dentists, but also general practitioners to become knowledgeable in this area so they can go back to the dentist and request from the dentist to step it up. Dr. Foltz at swissbiohealth.com offers 4 times a year a 1-week training where dentists learn how to properly fix the jawbone, how to properly place the zirconium implants and select the correct shape of the implant, but also supportive protocols before, during, and afterwards. And that's, I think, all I want to say here. I'm wondering now if we can take a few more questions. Yeah, so Destiny is going to help me with that. Oh, these are the written questions. Okay. Okay. Okay, but can I answer in writing or I answer in? Do I talk about? Okay. Okay. Answer live, I guess. Yeah. Okay. So first question is from Miriam from Israel. I have pain in a tooth for a few days, scared to go to a conventional dentist. What are the at-home options to relieve the pain, or what is causing it? So first of all, aspirin was invented to treat toothaches. So it is amazingly, ibuprofen and aspirin are amazingly effective tools for most of it. But what you can do at home yourself, you can determine whether there is tooth decay, if you see like illness from the outside invading the tooth, or if the tooth looks healthy. If the tooth looks healthy, then the illness is on the inside in the pulp. And there is a number of things that we do here. First of all, we have like 4 different colors lasers: blue, green, red, and purple. And usually we find a laser with ART testing that we can shine on the tooth and the tooth pain stops. It kills the bugs inside and the pain stops. One of the more common reasons for tooth pain when the tooth looks okay on the outside are the herpes viruses. The herpes zoster, especially when it invades the trigeminal nerve, can give you incredibly amount of tooth pain that lasts for a few days, but then disappears as quick as it came. And that, of course, should not lead to a dental extraction or root canal. But that's pretty much all I can say on the short. That's I can handle it. Yeah. I am. Okay, this is for Jill. I'm curious about the best way to remove mercury tattoos when there are visible chunks on an X-ray. How does the mercury exposure here compare to the exposure with mercury amalgams? Thank you. So you're raising a huge issue here. We had a patient recently who had very aggressively growing breast cancer, and we cleaned up a few things on the jaw, but then we found exactly that issue, that several mercury pieces in the jawbone hiding. And so we had to put her through that surgery to remove those pieces of mercury, and immediately the cancer stopped growing. So mercury tattoos are not harmless. Mercury tattoos, usually when the gum shows these black spots, there is a source of it deeper in the bone. These need to be surgically removed. Now, as a home trick that works often, people buy chlorella growth factor, that's chlorella that's in a capsule from BioPure, and you put that in a cotton roll, the typical cotton rolls that dentists are using. Fill that with chlorella and then stick it next to the tattoo and sleep. Make it wet and sleep with it at night. We've had people like over 6 or 8 weeks where the tattoo completely disappeared that way. But in general, it's a special skill of the dentist to remove the mercury tattoos from the bone, the mercury pieces from the bone. It can be very destructive, can have a very difficult course of recovery, but they have to come out. And it's understood how the mercury gets in there. The mercury from the teeth follows electric gradients and swims sort of upstream in the nerve or adjacent to nerves, upstream towards the brain. And then when the mercury encounters microbes, they form these mercury tattoos. So mercury tattoos are always a sign of the interaction of microbes and mercury. And the best solution is a surgical removal. But again, the skill level of the dentist is very important. We have a dentist in Hamburg, Dr. Gartz, who does what's called thin slice CT scans, where she can very, very reliably detect the tiniest metal particles in the jawbone, and then has a team of dentists around that are cued into removing that. And it's for them, they work in universities, so it's like it may cost $500 instead of $5,000 over there. So it's very worthwhile a trip over there. Okay, Jana Box. Let me see. Okay. Can laser detox therapy clear all toxic metals from the body without the need to do other detoxifying therapies? Can it clear infections from cavitations? Thank you so very much. I love your work, she says. So, Jana, to be honest with this, I don't know. We're the only ones that do the laser detox, and so far I'm not getting enough feedback. The German group that I'm working with, they've been doing the laser detox therapy now for 3 years, and they report remarkable long-term improvements in people. Now, what the laser detox therapy does, it desensitizes the immune system against the metals and against the infections. And the ground rule is the body can only detoxify toxins that it's not allergic to. Yeah? The moment you put a metal on the move, let's say from the brain to down the neck, and the immune system is sensitized towards it, it will viciously attack it and lock it in. You know, the inner lining of the little blood vessels will swell up and will lock the metals right back in. And so by making the system immune tolerant towards the metals, that our body has a much easier time to get rid of them. And so what I'm really saying is we like to combine the laser detox therapy and laser reset towards the infections together with the material things, with the chlorella, with the cilantro, and with the lime cocktail and so forth. Okay, let me scroll down here and see what else we have. When will it end? Somebody says. I don't know, in 5 minutes. Is it necessary to have the wisdom teeth removed? The absolute answer is absolutely no. The wisdom teeth should be removed if they're not fully erupted, or so if wisdom teeth are in place and holding their place and they're in a decent position, they definitely should be honored and praised for being there. But if the wisdom teeth are lying sideways in the jawbone, like they often do, pushing up against the front teeth, you have to know that every tooth on its top has some enzymes that are released, so the tooth chews its way through the bone, but it will also chew itself through the neighboring teeth if it lies sideways. So when the wisdom tooth is lying sideways, it has to come out, but again, only by a medical dentist who is comfortable doing that work. You know, when the dentist says, "Oh, like, we better leave it in because I'm going to injure the nerve," he is not the right dentist. You know, the dentist who does good surgical work is never afraid of the nerve. They're respectful of it, but they're not afraid of it. So let me just kind of click. Okay, Mandy Coolen. What does it mean if you have lumps develop over the cavitation sites post-surgery? What may cause this? Is it common? I have lumps that developed in the space behind my bottom back molars and one on my cheek that presses up against my bottom right molar, thereby making it hard to clean. The one on the left side developed about 7 months after my second surgery. The one in my cheek developed after my first surgery and has gotten worse since my second surgery. Is there anything that can be done to get rid of these lumps? Well, usually the lumps form when your healing system is turned on too much. When the growth factors in the jaw are kicking in, but they're kicking in you in a chaotic way. And so sometimes they're also if there is an undiagnosed viral infection in the background, we see sometimes these lumps develop. And so this is really a situation where we would have to check with ART, is this viral or is this just your own growth factors? The growth factors go out of hand when you're exposed to mold at home. So this is just in terms of the causes, but in terms of fixing it, you know, the lumps can of course be, it can be zapped with microwave, it can be fried, coagulated, and you can get rid of them that way. It's usually not a serious issue, but it's indicative of something else that's missing. So let me see. I'm not used to the popping up things here. Oh, so is there a link between Lyme disease and oral cancer? There is a link between Lyme disease and all cancers. Yeah, and so that's really more than oral cancer. You know, is more linked to the HPV virus, but the as you probably know, when you have Lyme disease, it disables sections of your immune system, and then everybody has a ball, parasites, viruses, and so forth. And so, yes, so the short answer is yes to your question. Okay. Now I take this maybe as, I do two more. What is the best oil to use for oil pulling? How long should you swish the oil around for? Usually, traditionally, it was done with sunflower oil. I'm personally allergic to sunflower oil, so I use coconut oil, which I believe works just as well. And it should be 15 minutes. That's what Dr. Karak, who developed that, suggested. You know, but when you swish around oil in the mouth, for 15 minutes, the entire blood volume circulates through that twice, 2 or 3 times, and exchanges fat-soluble toxins into that fat, and then you spit it out, brush your teeth, and so on. Okay, last one. Anything you're able to do for trigeminal neuralgia? That's of course a big question. I just went through that after some dental work. So those of you who've never had trigeminal neuralgia, I don't wish it on you. That's, you know, on a pain scale, if pain is rated from 0 to 10, if you have trigeminal neuralgia, it's like a 50. And so the most common trigger for trigeminal neuralgia are untreated or undertreated cavitations. You know, so that is our greatest success rate, is looking at the dental x-ray, panorama x-ray, having the cavitations cleaned out. If that is not working on its own, with ART, we find very, very often that the real culprit in trigeminal neuralgia is the herpes zoster virus, which has nestled itself into the ganglion, the trigeminal ganglion, which lies on the base of the brain. And that one we do always a therapeutic trial. There is not many remedies that are effective against the herpes zoster. You know, it's the black pepper extracts, which should be tried to take them internally. And then there is Valtrax, which has some ameliorating effect. And then the tooth, typically with trigeminal neuralgia, 1, 2, or 3, or several teeth light up like as if they're on fire. And that responds very well to the red laser. You know, just going to Radio Shack, if that still exists, and shining the red laser on there. The red laser is very, very antiviral. You know, the 632 nanometers, but anything between 620 and 670 nanometers work. The bright red laser, and the stronger the laser that you can buy at Amazon, the better. So listen, guys, so this is really all I know. In terms of our organization here, like, so the Sophia Health Institute, we're trying to incorporate all these things. I'm trying to educate the people around me, but also people around the world. Some of you know that I am disclosing that I am consultant to BioPure, and in England, I'm a consultant to Key Science, KI Science, and we have some teaching in the US, that's Klinghardt Academy. And the sort of, other than the German-speaking countries where I have a big presence, it's Klinghardt Institute is where I keep sort of relevant PowerPoint and information and things for self-education. The English people are poor, and I know some of you guys are too. And so I'm trying to give people as many self-help tools as possible. Bye.